My name is Landon Scott. This is my week discussion for intellectual disabilities. The definition of intellectual disability is a development disorder that gives children below average intellectual functions, which limits their ability to learn, problem solve, and adapt to daily tasks. Here's a few of some of the causes they can do, such as how they happen: genetic disorder, malnutrition, abuse like physical abuse, alcohol, drugs, premature birth, and even some environmental neglect such as head trauma, child abuse, like I said before, or traumatic brain injury during an accident. Some characteristics and common symptoms is they have below average intellectual functions like less than a 7 IQ, delayed development in motor, cognitive, sensory, language, and psychosocial functions, and they have difficulty learning basic stuff depending on their severity, and poor problem solving, limitation in performing adaptive behaviors such as self-care and safety. Some functional implications: there's 4 severity levels. Like I said before, there's mild, which is an individual can acquire ADLs and IADLs with vocal skills with minimal support to get the desired occupation that they want. They may need some level of assistance in certain circumstances, like attending education classes with some help, or starting a new job to get better familiarized with what they will be doing. Moderate, an individual will need need support in daily activities and self-care, like tasks like communication, social interactions through use of training or repetitive skills, such as, let's say, building a block and doing it over and over again. Moderate support is needed to perform specific applications such as money management or food preparations, for example. Some functional applications as a continued. This is severe. An individual will have some impairments in motor functions, physical functions, and the client can acquire communication skills through continued support, but they have to have it continuously. They will have to be supervised, and majority of the tasks relating to their occupation will have to be practiced daily. Profound, which is the most severe, an individual will have to be dependent on support 24 hours and will need specialized care and education when it comes to enhancing their sensory and communication. And then the stages of cognitive development, impact on development. Here's Cicero motor stage. Sorry if I'm pronouncing that terribly. 0 to 2 years. Children with ID experience may delay in developing proper understanding what an object will continue to exist even though it's been hidden, and may have a hard time developing proper coordination and fine motor skills, like trying to grasp smaller objects. Pre-operational stage, 2 to 7 years. Children with ID may experience delays in obtaining new language and may be unable to think symbolically, meaning they will find it hard to use words that represent the object or the ideas they may try to get out. Concrete operational stage, 7 to 11 years. Children may experience delays in developing proper conversations and classification skills. An example of this would be them struggling to group things such as objects by their color or size, for example. They wouldn't be able to tell the difference. Formal operational stage impact on ID stage would it depends on this one. This depends. The stage could be absent or delayed in some cases for severe ID, so that even though they may be severe, they may not have it. Children with ID may experience a lack of ability to think abstractly, in which that means they're unable to understand concepts such as love for another person, or unable to think hypothetically in certain situations. And here's some more basic impact on development, depending on the severity again. The motor development, low muscle tone, mild delays with physical, coordination issues in movement, cognitive development, slow at processing info, hard time problem solving, difficulty maintaining memory, and maintaining attention on a given thing or subject. Sensory development, they may be super hypersensitive, or which does mean they're super sensitive to any sensation of touch, or hypersensitive where they don't feel anything at all. Language development, they may have a limited speech and speech delay, limited vocab due to decreased ability in recalling words, and difficulty grasping and expressing concepts due to impairment. Psychosocial functions, impaired ability to properly respond to social cues, which can lead to sometimes aggressive behavior or them just not close off from people, and emotional outburst. How does this affect the child's occupation Let's see, ADL, self-care tasks, delay in independence with doing daily tasks. Routines like dressing and feeding, often requiring assistance. Leisure and play, limited ability to engage in social plays with other peers, could miss opportunities for proper developing cognitive skills and social skills. Education, slow progress with understanding abstract concepts, slow academic progress that needs support. Very limited social participation within the class. When the class like group activities, they wouldn't be able to interact. Health management, they will depending on again the severity, the children may need support 24/7 to ensure the child can do their occupation safely, effectively, and independently to the best of their abilities. And if it's the lowest one, which was mild, they may just need a little bit of assistance with some things, but not fully. Specific considerations for the occupational therapist or therapy. They should plan an intervention based on the individual's capabilities. Self-determination should be their main focus. Support and assistance may be required based on the individual's performance skills and severity and patterns in their occupation. ADL steps should be, for dressing, feeding, should be present and presented in steps, broken down so it's easier for them to follow. Family collaboration with different educational teams. Educational teams are important when trying to support the development of social skills. And collaboration with educational teams, like I said before, is needed to create a plan that needs to. Collaboration with an educational team is needed to create a plan that addresses the child's needs, like with the OT. And improvement of fine motor growth skills can be attained through activities of play. Here are my resources, and I hope you guys enjoyed my presentation. Thank you for watching.